On August 4, the Hempstead Town Board unanimously approved a contract proposal for trap, neuter and return services from Central Veterinary Associates, located in Valley Stream. Trap, Neuter, and Return, or TNR, is a program that helps control the feral cat population. The town's animal shelter has been providing this service to residents since 2011 and have performed over 18,000 TNR surgeries. The town suspended its program in March due to COVID-19. The new TNR program will lead to a greater feral cat population in the town of Hempstead. The new program reduces the number of intake days from 6 to 3 and the number of cats per person from 5 to 1. Supervisor Clavin believes the town's shelter, with a $5.4 million budget, cannot implement its TNR program in a safe manner. According to Hempstead Town Supervisor Don Clavin, the town's medical director, Dr. David Newbert, recommended that the TNR program be contracted out because the town's shelter could not implement its program in a safe manner. Dr. Newbert is an emergency medical doctor who has no professional experience in TNR or epidemiology, according to his LinkedIn profile. Although Supervisor Clavin gives Dr. Newbert the credit for coming up with the idea of outsourcing the town's TNR program, Dr. Newbert did not speak at the hearing on this issue, nor did any town official explain why Central Vet's program would be any safer. From a public safety point of view, the program to be provided by Central Veterinary Associates does not provide any additional safety protocols that the town could not have easily provided, like putting the intake forms online and limiting the number of residents in the shelter while picking up or dropping off cats. When the World Health Organization declared COVID-19 a pandemic on March 11, Dr. Newbert recommended keeping the town senior centers open, even though it was well known that senior citizens have a greater risk for developing more serious complications from COVID-19. In contrast, the town of Riverhead, a town that does not have a medical director, closed its senior center on March 10, the day before the World Health Organization declared COVID-19 a pandemic, to protect its senior citizens. Dr. Newbert recommended some simple steps to prevent the spread of the coronavirus. None of them included wearing a mask or practicing social distancing, which are the most effective methods for preventing the spread of a virus. The town never needed to suspend its TNR program. The governor's executive orders always permitted veterinary medical services. All Dr. Newbert needed to do, to ensure public safety in the shelter, was recommend that masks be worn, limit the number of persons entering, and put the TNR forms online. It was well understood, over 100 years ago, during the Spanish flu pandemic of 1918 to 1919, that wearing a mask was an effective way to prevent the spread of disease. According to the town's request for proposal, an evaluation committee was required to award the contract. The response from a FOIL request for these records indicates that the town did not select an evaluation committee to review the contract proposal presented by Central Veterinary Associates. Even though the town did not use an evaluation committee in the contract award process, required by the town's own RFP, the town's compliance officer, Thomas Wildig, found the contract to be compliant the day after the town board voted in favor of it. There is a lot of public demand for the town's TNR services. An online petition to resume the town's TNR program got over 37,000 signatures in 10 weeks. At the July 1 town board meeting, over 55 people submitted comments in support of the town's TNR program. At the August 4 town board meeting, despite having no public support for the contract with CVA, the town board unanimously approved the contract proposal. After examining all of the facts surrounding the town's new TNR program with Central Veterinary Associates, it is still not clear why there is any need to outsource the town's TNR program. The Hempstead Animal Shelter has more space and on-site parking, which allows for greater social distancing. This will allow trappers to remain in their car, while town employees pick up and drop off the cats. This safety protocol is not practical at the Central Veterinary Associates location, which does not have on-site parking and insufficient on-street parking. The town's shelter also has a $4 million payroll, with 47 full-time employees, and nearly $600,000 allocated for part-time staff. Supervisor candidate Don Clavin made a campaign promise to fix the town's animal shelter. The contract with Central Veterinary Associates does not do this. Supervisor Clavin says that the outsourcing of the TNR program is for public safety, but this outside contract does nothing to improve public safety. This new program is just a watered-down version of the town's TNR program, which is more costly and less effective. Since public safety is the reason Supervisor Clavin gave for outsourcing TNR, residents deserve a reasonable explanation, since they are the ones who are going to be paying a higher price for an inferior service.